Welcome to the Health Trip Podcast. My name is Jill Foose. I'm a functional medicine and integrative nutrition health coach. I created this podcast to bring you along as we travel down intriguing, science-packed roads, debunking old medical paradigms and perusing new innovative therapies and modalities with the finest functional medicine doctors, practitioners, and like-minded biohackers while living our best life. Enjoy the show. Hi, everyone, and welcome back to the Health Trip Podcast. Today, we are diving into one of the most empowering topics for women in their 40s, 50s, and 60s and beyond, longevity through the lens of personalized health. Midlife is not a decline, it's a recalibration, and this is the perfect window to tune into your body's needs, optimize your biology, and set the stage for decades of vitality. As the science of longevity continues to evolve, women are no longer sidelined in the conversation. We're talking about the tools, tests, and strategies tailored to you, not based on outdated, one-size-fits-all approaches. And in this episode, we're going to explore how personalized medicine is reshaping midlife health, including a breakdown of the vital role of mitochondrial health, the powerhouses of your cells that affect everything from your energy levels to hair growth to how quickly you age. When mitochondria start to sputter, so does your resilience. But with targeted support through movement, nutrition, and certain strategies, you can dramatically improve how your body creates and sustains energy. We're also going to get into nitric oxide and why all midlife women need to understand what this amazing molecule is, does, and how we can support its production in the body. My guest today is Dr. Gila Senamar. She is a board-certified obstetrician and gynecologist with over 20 years of clinical experience dedicated to advancing women's health. She's based in Miami, Florida, and she is renowned for her expertise in menopause, hormone therapy, and metabolic health, providing innovative and evidence-based care to help women thrive at every stage of life. Her professional journey includes academic appointments as an assistant professor at the University of Miami and voluntary faculty roles at Florida International University's College of Medicine. She also served as the associate medical director of obstetric and gynecologic triage at Jackson Memorial Hospital. Dr. Gila's commitment to empowering women inspired her to establish Gila MD, a concierge practice that provides personalized care with a focus on perimenopause, menopause, hormone therapy, metabolic optimization, and longevity science. As the founder of the Miami Menopause Collective and Empower Her Miami, she collaborates with patients to tailor holistic treatment plans that align with her unique health journeys. She's contributed to several medical publications, including chapters on gynecologic surgery and adolescent medicine, and also serves as a thought leader in women's health. She is widely appreciated for her compassionate, patient-centered approach, helping women embrace vitality and health through every decade of life. Short medical disclaimer before we dive in. By listening to this podcast, you agree not to use this podcast as a medical advice or to make any lifestyle changes to treat any medical condition in yourself or others. Consult your own physician for any medical issues that you may be having. And this entire disclaimer also applies to any of my guests on my podcast. So sit back and open your mind and let's dive into the longevity for midlife women. Hi, Dr. Gila. Welcome to the Health Trip Podcast.
Hi, Jill. Thanks for having me today.
Yeah, I'm really excited to have this conversation with you. It's a conversation and a topic that I don't think is talked about enough when we're talking about longevity for midlife women. And so I want to know from you, what does longevity even mean to you when we're talking about women going through the menopausal transition?
You know, what I see every day, talking to my patients is they're not very well aware of what's going on in their bodies in midlife with the hormonal changes and things like that. And they know something's off, but they don't really know how to address it. And what I've come to realize is we need to explain more to them the importance of their hormones, of their well-being, nutrition, exercise, all of that, because that all plays into their health moving forward. And that's where I've kind of brought in the longevity aspect for them, is kind of opening up their eyes to that. It's more than just treating you with hormones and this and that. It's about you being well, living into your 80s and 90s and beyond, taking care of your heart health, taking care of your bones and your brain as well. So that's where I've seen lack of information, lack of understanding, that so they think the hormones are just kind of a band-aid to
Mhm.
cover their symptoms, and that it doesn't play into the longer health and their well-being and taking care of their body. So with all of that, we talk about how hormones play a role in your heart health and prevention of heart disease. It also talks about how it protects your bones from osteopenia, osteoporosis, as well as
Mhm.
brain health, dementia, Alzheimer's, all of that. So we get into that with them, and now they're having a better understanding. They see it's more being preventative rather than reactive. I don't want them to wait to have a disease and then treat the disease. I
Mhm.
want to get to the root cause now so we don't have those problems going forward.
Yeah, I always say that every woman has their own unique health equation, and midlife is a recalibration of our lifestyle and our mindset. And so many women, as you see every single day, are just in a panic over, I just want to feel better today, now, not tomorrow, now. I want to walk out of this office and I want to feel better. But I do like to help my clients look at their mindset and how they're thinking about what you're talking about, your 60s, 70s, 80s, and 90s, because we want to get there and we want to still be strong and vibrant and useful and productive and independent. And so I do think that there is this conversation that has to be had over longevity and what that means, your health span versus your lifespan. It's how long are we going to live, and in what status and what state are we going to live?
Right. What's the quality of life going to
Yeah.
look like when you're in your 70s and 80s? Are you walking with a walker, or are you out there
Yeah.
pushing weight, taking care of your grandchildren and running around with them? What do you
Yeah.
want to do? How do you want it to look? Again, and I think we all have families and we have children, and we don't want to be a burden on them the way, like,
Right.
we are all that sandwich generation right now, right? We have our families we're taking care of and older parents. And to see your elder parents going through diseases and disorders and sometimes even succumbing to them because of what you can see, the deterioration in their health over the years, to see that happen and not be able to do anything about it because, again, it wasn't discussed, it wasn't addressed. It's really difficult. And so, I want to take ownership of that. And I want to do better for my patients. I want to do, again, lead by example, right? So I take care of me.
Mhm.
That way, I want them to be able to do the same going forward.
Yeah. And I think it's important to also, for women to understand the biology of their bodies, right? What's making the engine run, right?
Hmm.
Not like you said, the hormones are great and I take them, and that conversation around hormones is just blowing up. Thank goodness.
Hmm.
But we still need to know what is going on under the hood, because sometimes understanding the biology will help us find the motivation to make the lifestyle behavior change. And so I talk a lot on this podcast about exercise, nutrition, sleep, stress management, community, all those pillars of health that health coaches talk about. But today I really wanted to sort of shift gears and talk about mitochondrial health. And this is something that is not so sexy out there on social media, but I love geeking out on mitochondrial health. And so I'm hoping that you can really shed light on what this is, what this means to us. So, what are mitochondria, and why should midlife women know about them, and also how to support them?
So it's crazy, but these are things we learn about in physiology
Mhm.
101. And now to, this many years later, to go back to that science, it's interesting how it's evolved, how it's shifted, and the conversations around it, especially in the longevity,
Mhm.
space right now. That's all we're talking about. Mitopure, this, those peptides, everything's coming out, and it's great to kind of get that information out there, but in a in an understandable, easy way for people to get it and not, go too crazy with it. Because listen, you can all become Brian Johnsons, or we can be somewhere in the middle where you do what's reasonable. Okay, there's so many, it's like opening a Pandora's box. Like, how many things do you want to do to yourself? And
Yeah.
what's going to be what counts and what doesn't. So with mitochondria, they're the little engines in your cells, right? They make everything. They turn the food that you eat, and they break it down and give you the oxygen and the energy that your cells need to thrive and give you energy, gives you mental balance, resilience in times of stress and inflammation. So it fights all of that. So the mitochondria are the powerhouses of your cells. That's where it's like the little engine that runs everything that you do. What we know about them is, as we get older, they don't work as well. They're not as efficient. And there's certain things that symptoms that you can notice that will tell you if the mitochondria is functioning well or not. If you're tired all the time, brain fog, muscle weakness, just you just feel like your body's getting older and you're aging, and you just don't feel like yourself, like your body doesn't belong to you. These are all things that we know is because there's an underlying root cause at the cellular level, and we need to address it appropriately.
I mean,
Um,
that sounds like perimenopause to me.
well, so that's a great thing, Jill, is because we can put it all on perimenopause
Mhm,
and say that's what it is. And
mhm.
that's what we as practitioners and healthcare coaches, we need to be able to address our patients and say, most likely, yes, but we got to rule out other things as well. So you have to make sure it's not a thyroid problem, iron deficiency, anemia, all of those things, they can mimic a lot of the same symptoms.
Right.
So, and we will talk about blood work and labs and things like that, but these are all the things that we need to address. And, together they can all be corrected nutrition wise, supplementation, and then again, hormones as we see fit per patient.
So what's the connection between declining estrogen levels and mitochondrial health?
So just like we know, there are estrogen receptors everywhere, including on our cells. So as the estrogen levels dip and lower in our midlife and in perimenopause and menopause, then the functionality of that mitochondria is not as well. And it's not as efficient. And hence you become more fatigued, you have brain fog that you can't get over, you just don't feel well, you're tired all the time, you're grumpy, you're irritable. It plays into everything. So we really need to address all of our nutritional balances, and as well talk about hormones with women when they come in, but
Yeah.
get to a cellular level. Otherwise, they're not going to per se be sold on it, because it can't be that easy of a fix.
Yeah. So on social media, there's a lot of physicians and influencers who talk about oxidative stress. And I know
Mhm.
that mitochondria are responsible for becoming more vulnerable to this oxidative stress, but I don't think people really understand in layman terms what that means.
Yeah. So, and you hear about, free radicals,
Yes.
antioxidants.
Yes.
Oh, antioxidant rich diet. What does that
Hmm.
mean? And why is it important, right? So
Hmm.
it's basically a formula in your body, in your cells. Free radicals and antioxidants. Your body, when, it's breaking things down just from eating and exercise, free radicals are unstable molecules. Basically, imagine it being like a little lightning rod going off in your cells as things are being broken down. And you can also get free radicals from outside, influences like environmental, it could be pollution, it could be
Hmm.
from alcohol, it could be from stress, it could be processed foods, smoking. These are all other things that can increase the level of free radicals in your system, and they're not good. So we need to get rid of free radicals. What gets rid of them? Antioxidants. Okay, they're like the little fire extinguisher that can put out those flames that are happening within the cells as things are being broken down. Antioxidants, you get them from food, basically. It's like colorful, we say
Hmm.
green leafy vegetables and berries, pomegranates. I grew up in the Middle East. Pomegranates were like everywhere
Hmm.
for us. I come here, it's like a delicacy. It's like, oh, pomegranates. I'm like,
Right.
what do you mean? Like we had that all the time. Like that was our
Hmm.
fruit,
Hmm.
But
hmm
now going back and realizing like what I was raised on was a very well balanced diet. I just didn't realize it. And now here I have to work extra hard to get the same components in my everyday, nutritional balanced diet. But so those are some of the easy ways to get antioxidants into your system. So that way your cells are functioning well and can get rid of those free radicals. So oxidative stress is when you don't have enough antioxidants to fight off the free radicals, then it builds up in your system. How does it show up? It shows up at the cellular level, affecting your DNA, the way those mitochondria work, the way the proteins are built in your body, as well as the well-being and the health of the cell membrane. Okay, so it affects everything. Over time, as the cell isn't as healthy as it should be, you see, there's heart disease development, bone disease. It could lead to Alzheimer's. It could lead to dementia. It can lead to muscle fatigue, all of the above. So we keep saying the same things over again but they're all related on a cellular level. That's why it's so critical to make sure that we address it and to watch the free radicals and kind of keep that homeostasis. That way the cells can be as efficient as possible.
Now, do genetics play a role in mitochondrial health from person to person?
There can be some genetic component to it, but
Mhm.
what we've noticed is really it's diet. Our
It's
environment.
the
It's
epigenetics.
epigenetics.
Mhm,
Exactly. That's where
mhm.
it's coming from.
Yeah, so interesting. And then, a lot of people talk about this process of autophagy, which we know is the cell turnover, right? But then there's this it's kind of like subcategory called mitophagy.
Mitophagy, yeah.
Yeah, tell us a little bit about mitophagy.
So autophagy is basically all the cells breaking
Mhm.
themselves down that are not working well and then creating new ones. Mitophagy is specifically what happens in the mitochondrial aspect of the cell. And so, they're the power plants per se, or the powerhouses of your cells. And over time, because they work so much, they become damaged or they're just not efficient. And mitophagy is this special process where your body basically breaks down those bad mitochondria that are not functional anymore. This will then keep your cells functioning well, and it prevents buildup of cellular waste inside the cells, and that way they can be more efficient in their function.
So, what are some ways that midlife women can support their mitochondrial health?
So, a lot of that is based, a lot of easy things. So I like to look at the health pyramid. Like the base of that pyramid is the most critical, which is nutrition, exercise, sleep, things that we can do and modify easily at home. And then that will then lead to a better cellular health. And then comes, adding in supplementation, hormones, peptides, and UV and red light therapy and all of those amazing things that we have happening out there. In terms of specifics, you want to make sure exercise regimen, right? It is more weight-based resistance training, hit training, things like that to kind of get your body, that oxidative stress level kind of minimized there. So that
Because
way,
don't we have the most mitochondria in our muscle cells?
we sure
Like it's
do.
it's
And
very abundant there and in our brain, right? It's
correct.
not,
Those are
yeah.
the two big ones right there is, and
Mhm,
you know, we get all that brain fog, we get muscle wasting,
mhm,
weakness,
mhm.
fatigue, all of that. They all kind of play in together. And so if you can optimize those levels by the appropriate exercise regimen, by eating the right things, then you're just going to be helping yourself.
I just thought of something that I wanted to ask is, do you think that starting with hormone replacement therapy versus starting with just lifestyle intervention change is a more beneficial way to go? Because once you can get a woman feeling better, she's now more motivated to take on these really challenging lifestyle interventions. That's what health coaches do, right? We work on all these pillars of health, the behavior change, all these different strategies. But if our client isn't feeling good and still can't get her sleep, still can't get the motivation she needs to get out of bed in the morning to, eat something with protein and some carbs to get some workout in, like I'm just thinking about this like vicious cycle.
Yeah, you're absolutely right. We need to get those pillars of health nice and strong, Jill, before, addressing the hormonal side.
Mhm.
I honestly look at each patient as a case by case situation and seeing
Yeah.
what's really going on. Like if the quality of life is just devastating and they can't function whatsoever, and they're in their late 40s, 50s, the early 50s, then we're going to hit them with the hormones just to kind of balance that
Yeah.
out first and then work backwards. Now I'm seeing a lot of younger patients who are becoming more proactive, which is honestly, it
Mhm.
makes me happy. It makes me know that our word is getting out, our work is being, you know, heard and being applied, because I have a lot of 30-year-old, 40-year-olds now coming in with barely any symptoms, but they want to be ahead of the game. They're like, I want to be proactive. I don't
Yeah.
want to wait to feel terrible and be yelling at my kids and, almost quitting my job. So what do I need to do? And that's where I think it's very beneficial to just come in with them at like that pillars of health, hit them with all of that. And
Mhm.
that's what I do. So with those patients, I would remedy the nutrition component. I would remedy the exercise regimen and then have them come back, report back, and then we start adding in supplements one at a time. And I
Mhm.
may get them well like that for a few years and they're okay. And then, mid 40s hit and now everything else is starting to decline. But now they're more aware of what perimenopausal symptoms to be expecting. And when that starts to kind of rear its ugly head, they come back in and then we can start talking about hormones.
Oh, yeah. I mean, I was just in my gym the other day and there was a woman my age there, and she said, I just started lifting weights and I'm 57 years old. Like, this is the
Mhm.
first time I've ever done it. I can't believe I've waited so long.
Right.
And so I thought to myself, I have the conversation with my daughter who's 28, and she lives a healthy lifestyle, and like she's just set up for an easier transition than so many women were, because we just didn't have the information back then.
100%. And that's what we're doing. We're making it easier for the next generation, for all of our
Totally.
daughters. They're just going to skate through this because number
Yeah.
one, they hear us talking all the time. I have
Right.
I have
Right.
three young adults and my boys are already talking about this. So they're friends'
Hmm.
moms. Okay. So it's getting out there. We're spreading, the good data and information that we have. And again, to you and I, it's kind of like these are the basics. What do you mean you
Right.
don't know
Right.
this? Like, but then I sit and listen to women and I'm like, no, it's basic to us. It's not basic to,
Right.
everybody else. And so that's where I think we're making the biggest impact is with these younger generations, and they're going to have it hopefully a lot easier than we did. And I'm makes me very optimistic.
Yeah. So we talked about exercise as one way to support our mitochondrial health, our
Mm-hmm.
muscles, and we
Mm-hmm.
talked about, eating polyphenol-rich foods, those antioxidants. Um, And we talked about sleep. What about other things like intermittent fasting? There's like such controversy out
Yeah.
there. How to do it? Is it 48 hours, 72 hours? And it's the equation for men is not quite the equation for women.
For women, yeah. And intermittent fasting works for some people and not all people.
Mhm.
And so I have this discussion with patients and they're like, I want to do this, I want to do that. Again, I think each person, it's personalized, individual. And it's like, okay, you can do the intermittent fasting, we can give it a try and see how you do with it. And like you said, it's 50-50. Some there's pros and others there's cons,
Mhm,
but
mhm.
so it's good because we know the cells rest, regenerate while you're fasting. And so it allows your body to become more efficient when you do eat that, rich food in those hours where you're not fasting. But again, does it work for every patient? No. And it's a trial and error situation. But I do think it is a good cornerstone of everything that we do for mitochondrial health.
Yeah, I always start with just fast overnight, right? Stop
Mhm.
eating after dinner and wait until your breakfast. That's like
Right.
super easy. Get in bed, read a book, take a walk, whatever it is, but just close the kitchen down after dinner. And there you
And
go.
see how you do. And if they do well
Exactly.
with that, then they extend it to like lunchtime or just black coffee in the morning. And then they'll eat, between like 1 and 8 p.m. and something like that. And then we just
Yeah,
kind of play around with it.
exactly. Yeah. So I want to move on to another pretty cool molecule in the body called nitric oxide. And this
Yeah.
definitely does not get any airtime in the menopause verse.
Mhm.
So, what is nitric oxide and why should midlife women know about this?
So nitric oxide, it's basically it helps dilate your vessels, and so relaxes the vessel walls, and that way you get more blood flow to certain organs in your body. And why we love it and we talk about it is because the vasculature around the heart, around the genital area, and the brain, it helps deliver oxygen rich, nutrient rich blood to those areas. That way we can be more focused, more well balanced, and it also plays in with your hormonal changes and everything like that. So in women, it's like a signaling molecule telling the blood vessels to relax, widen, improving blood flow, oxygen delivery to this, the critical parts of a body. Um, in perimenopause, as with everything else in terms of hormones, as the hormones decline, so does the responsiveness of nitric oxide, hence causing, stiff arteries around the heart and other parts of your body, sexual health decline, because now there isn't enough sensitivity or blood flow to those areas. And so women just have other sexual problems. And so things we have to talk about. But if they don't know even what nitric oxide is, that's kind of where we have to start with the discussion. But that's great because nobody talks about it. It's one of
Nobody
those
talks
things.
about it.
No, at all.
I've been on it for like decades because I have had low libido for, off and on for decades.
Hmm.
Um, and so I've always looked at, well, what can I start with that's like already happening in my body, and what supplement can I take to support it? What can I eat to support it? What kind of, lifestyle is going to support more nitric oxide? And, sexual pleasure hits hard in midlife. This is a conversation I talk about all the time on my platform. And I think that when women can see, again, the biology of what's going on, it's not your fault that you don't have a libido. There's reasons why this is fading for us, but there are things that we can do to support it. So some of the things that people have done to support nitric oxide or their sexual pleasure, something like the PRP or the O shot. What are your thoughts on that? Another controversial topic.
Yeah, so the PRP is, where they take the plasma, your blood, the plasma component, and they inject it into the vaginal tissue, and to bring back basically the nitric oxide and the blood flow and vasculature to that area, basically causing engorgement. That way the sensation improves. And again, none of these are FDA approved. So let's put that out there,
Right.
number one. But there is promising anecdotal evidence behind it. And there are people who do this all the time. And, I know they're in California and other areas, they're more popular.
Yeah.
But there is good, anecdotal data behind it, and patients feel much better afterwards. But it's one of those things that has to be repeated over and over again. It's not a one
Right.
and done. They have to
Right.
continue. And the newer one is the red light therapy, Halle Berry's Joylux device that again is showing promise, but we don't have enough information on it yet either. And lasers.
Yeah.
Lasers are another thing that
Yeah.
we
What are your
use.
thoughts on lasers?
I've used them. I've been one of the first people to use a Mona Lisa treatment for the vaginal tissue. And to be honest with you, I've had really good success with it. Not FDA approved. It's, we're off-label use, but I think in the right patient population, it does help support that vaginal tissue, brings back the collagen, the elasticity, and the sensitivity. And they're very happy with that. But what I do like to do is a combination of approach to it, which includes pelvic floor therapy. Then I do
Hmm.
the laser, because the laser is only like 3 treatments, and then you can do touch-ups as you go. So that
Hmm.
kind of gives it a push. With the pelvic floor therapy, they maintain it. And in addition to that, I love vaginal estrogen cream. So I add that on top of everything, and they do spectacularly afterwards.
Now, is there a relationship between the results from vaginal estrogen and nitric oxide production?
So there is some studies that show it can help improve that, because again,
Mm.
what are we doing? We're re-elasticizing the tissue. So there's more vasculature in that area, which then nitric oxide is increased, dilating those vessels, providing more blood flow. So yes, they're connected.
Very interesting. And I am a red light therapy junkie. I use it for
Mhm.
my hair because I've had hair loss for 27 years.
I have,
Yes,
yes.
yeah, yeah. I wear it on I just bought a new face one. I have a body one. I
Mhm.
have the vaginal one. I don't use that one as much. But red light therapy, well, because we were talking about mitochondrial health, just to go back for a second,
Mhm.
it works on energy respiration in the cell.
Right.
And that's the magic of it. I mean, the main use is mitochondrial health.
Yep. That's why they started with it. And that's why,
Mhm.
they have it for every part of your body. So it's
Yes,
regeneration,
right,
restoration,
right.
repair, all of the above. So,
Yeah,
I actually have the Saluma panel that you can use pretty much anywhere on your body. And I think it's fantastic.
yeah.
There's good evidence behind those. Again, they're not FDA approved, but again, that's what we're working on is all the evidence and the research behind all of these therapies.
And so what can midlife women do to support nitric oxide production?
So again, let's go back to food. The nutrient dense foods, such as like beets, arugula, spinach, celery, like the greens. Again, pomegranate. It's like it's the hero fruit, if you per se. So berries and pomegranates seem to pop up in a lot of these discussions that we have. So
Mhm.
I would start there. Exercise, especially like aerobic exercise, can help improve and stimulate nitric oxide production and help with the dilation of blood vessels. Managing our stress levels, chronic stress and poor sleep will
Mhm.
reduce production of nitric oxide. Um, and again, certain supplements have been shown to help produce and increase efficiency of the nitric oxide in your system.
Yeah, so I use an interesting supplement called Nova Complete by New
Hmm.
Medica, which is
Hmm.
a great company. And it has the beet powder, it has like 3,000 milligrams of L-citrulline. And L-citrulline is an amino acid, as you know, that converts to L-arginine. So it's this
Hmm.
pathway and L-arginine converts to NO down the road. And so it has really helped me. I use it every day, whether I exercise or I don't. I just use it as a daily supplement. I've been using it for probably 5 years now. Now I'm just so used to it, but I use it in my pre-workout drink because if I can get it in 30 minutes before I work out, I definitely, it's opening up those red blood cells, right? It's getting
Hmm.
your vascular system moving and improving that circulation for when I work out. So, I wonder at this point, if I stop doing it, would it make a difference because I'm doing so many things? I don't know, but they do have some science behind this
Hmm.
specific targeted supplement for nitric oxide production.
Yeah, and you can take, I like yours because I actually didn't know that one was there because a lot of times, I
Yeah,
tell them to take them
right.
separately. But that's amazing because it does actually help. And I don't give a list of supplements like a
Yeah,
mile long. They're targeted supplements. If you
yeah.
have a very well balanced diet, that's also clean, right? No, non-processed. And you just take this set of supplements, I think you will optimize what you need to be doing in terms of mitochondrial health going forward.
Yeah, one of my favorite tests to look at, because I want to talk about tests with you,
Hmm.
is a micronutrient test that looks at like 50 different micronutrients on a cellular level, right? Because you were saying mitochondria, it works because of the nutrition that we're bringing in, whether it's from food or from supplementation.
Supplements.
And so what's actually getting into your cell and working. And you can see on this test where there's deficiencies, you can really personalize. That's why I love personalized medicine so much because there are some common denominators with supplements, as I'm sure you would agree, right? Protein powder,
Right.
collagen, creatine, these are all common denominators that most women should be using. Um, but then there's very specific targeted ones, and it gets really dangerous when people take things that they don't need or they take something they do need, but not at the right dose or in the right form. Can you speak
Right.
to that?
So, there's a lot out there now about, peptides and
Yeah,
glutathione and NAD and this and that and NAC and what do I take and how do I take it and over the counter versus injectables and what do you do? And there's a lot of science behind that. That is its own course certificate. It's like a whole different ball game. And
yeah.
unless you're part of, functional medicine and the International Society, and you need to be really careful where you're getting this from, who you're getting it from,
Yeah.
and even go beyond that. It needs to be cycled. A lot of these things are not like your regular vitamin D3 that you take on a daily basis. It needs to be taken on a cycle because too much isn't good for you, just as too little isn't good for you.
Right.
So, like you were saying, the micronutrient testing, the methylation tests, things like that need to be looked at, evaluated. And again, these are things that I've gone above and beyond to include in what I'm going to be providing going forward, because in a traditional OBGYN setting, it's just not feasible to do that. So that's why I had to go to a more personalized, precision age management GYN combo practice in the near future, where I can address all. I don't want to just treat my patient with one thing and say move on to the next person. I want to be able to provide all of that for them. And so with these specific tests, we can see where are your defects, how can I best address them nutritional wise, supplement, and then moving on to hormones. And so again, it's very, very nuanced. It's case by case. And those labs are 6, 7, 8 pages long. And unless you
Right.
know what you're looking at, there's no point in even doing them. So there's a lot of good testing to be done. There's a lot of different things to look at, special biomarkers for the cardiac disease and things like that. You don't just do a lipid panel. You have to run the other biomarkers to see what's going on, and then how do you
Yeah,
address
talk
it?
about that. Yeah, expand
Yeah.
on that because so many women are getting just this, they go to their annual checkup and they just get the standard lipid panel. And,
Mhm.
I guess if they don't have a family history and they don't have, well, unless they've done genetic testing, maybe they don't know if they have something, but um, the standard panel might not be good enough in midlife.
Unfortunately, it's deficient in a few things. And as we know, as estrogen levels decline, your LDL, your triglycerides can be affected. And so your lipid panel that used to be completely normal is now abnormal. And you have an elevation in your LDL and triglyceride level that you never had before, even though nothing else has shifted or changed. Your diet and your exercise regimen is completely the same. So it's your body basically telling you something else is going on. So you can't really rely on your typical lipid panel. You need to do further testing on that and look at the LDL particles. Look at
Mhm.
ApoA and ApoB and lipoprotein little a. Those are because lipoprotein little a tells you if there's a genetic predisposition to
Mhm.
cardiovascular disease, plaque formation. ApoB tells us, hey, yeah, maybe the LDL is elevated a little bit, but their ApoB is low, hence there's no chance of plaque in this individual. Or if they're elevated, then it gives you an opportunity to look further at this patient who now really wants to be on hormones. But again, you don't want to be precipitating a problem if there is an underlying issue going on. And that's where, we're not being complete with women because they need a full cardiac evaluation. But that doesn't mean a stress test per se. It could
Right,
just be
right.
something easy. You could do an EKG on them. You can do a calcium score and see
Mhm.
what are they looking like. And if all of that is negative, then you have a pretty solid foundation for this patient to do a trial of hormones and then down the road check their lipid panel again. And guess what? More than likely it's going to be okay.
Mm, that's so interesting because online, I read so much on social media where people are just really poo-pooing statins. I'm on a
Mhm.
statin. I do all the things. I've been doing all the things for 40 years, but I have horrible family history and I
Right.
have horrible genetics associated with heart disease. So for me, it's a non-negotiable. I'm on
Right.
a statin and I'm on a Zetia, right? Because I'm a
Mhm.
hyperabsorber. And we're not going to dive into like what all of that means, but I wanted to get what your thoughts are on, I like your approach of, you know, getting everybody stable with their lifestyle intervention and then sort of layering on top these different components to longevity, right? So then getting hormones started if the person is a candidate for it and wants to do that. And then layering on, maybe more deep dives into certain biomarkers like an extended or advanced lipid panel. Um, but I also like how you just said, start with the hormones and test later because down the road, their lipids may have changed, but what if they don't? And then
Right.
I am curious as to what your thoughts are on women, midlife women having to use a statin if needed?
So I've spoken to a cardiology friend here in the community who is, open, and we've had an open discussion about hormone therapy and how it would play in in midlife women. And after we trial it out, and if their levels are still elevated and we're still concerned about them, we would have a discussion. It's a team effort. And so with him, we go over it and like, okay, what's the family history? What are the genetic predispositions or risk factors for this individual? And if we see it, deemed necessary, I would totally completely have them try out the statin and see if we can lower it. And then again, for me, everything is trial and error. I'm going to try this. We're going to try it, see how it goes. And then maybe you're on it for a little bit. Now you want to come off and see where your levels fall. It might be okay at that point to maintain you on nutrition as well as
Mhm.
your supplementation and your hormones, and you may not need the statin anymore. But if it is somebody like you who just has it and there's nothing
Yeah,
else we can do about it, then you're going to stay on it, and we're
yeah,
going to, do like the minimal dose as necessary to
yeah,
keep you in the healthy range.
yeah, yeah. Yeah, that's what other tests do you use in your toolkit when it comes to midlife longevity?
So let's see. We do a lot of the blood work. So we do the complete blood count. So make sure they're not
Hmm.
anemic, and then our iron panel. So to make sure there's no
Hmm.
iron deficiency, absorption, the binding capacity, all of those. We do the full hormonal panel, which is your FSH, LH, DHEA, sex hormone binding globulin, estradiol, progesterone, testosterone free, and total. So that's that panel, and then the full thyroid panel, even the thyroid
Yeah,
the antibodies, thyroid peroxidase. Again, I want to make sure I'm not missing any of those things,
right.
because you can, let's say you have a patient who needs hormones. So you put her on the hormone therapy, but then you realize, hey, she has really high antibodies. Even though her TSH and free T3 and 4 are normal, she's at risk of developing Hashimoto's hypothyroidism down the road. And maybe, she may not get the same effects. Like she feels well, but she can't manage to lose the weight still, no matter what she does. And her inflammatory markers are elevated. Hey, maybe adding a little bit of thyroid medication, just a touch, may help push her balance over where she can actually lose the weight and continue feeling well. So it's those little tweaks that need to be, looked
Hmm.
at and addressed with the patient accordingly. And sometimes they're up for it. They're like, no, I just want to give it a little bit more time. I don't want to be on so many medications. And I can understand that.
Yeah.
Thyroid medication is a lifelong commitment. And, it's one of those things that you have to be careful with. And so I let them try. And then, if they come back and they're frustrated, then we can add it on. And again, we try it out, we see how you do, and then we continue from that point on. So those are the panels. Then I do, like I said, the calcium score. I love
Yeah.
my mammograms, breast ultrasounds, make sure all of that is in tip-top shape, negative, benign, no risk factors. And then I will do a bone density, because I want to know, do I have a patient with osteopenia already? Because then I'm going to be a little bit more aggressive with her versus somebody who has a normal bone density and is 45 and doesn't really have symptoms. Okay, I can wait on her to start hormone therapy or have the discussion about it. The average age for a baseline bone density is 65. I think at 65, we've already missed the boat. So,
Totally. I am the poster child for living a healthy lifestyle, being on hormones for, over a decade at this point. And last year I was diagnosed with osteoporosis.
okay.
So I'm the poster child that it doesn't always move in the direction you think it's going to go, right?
Hmm.
And so, I had to tweak some things alongside my providers in terms of supplementation or lifestyle interventions to help support. And I'll go back in about 6 months, have another DEXA. So I
Hmm.
saw the progression from osteopenia to osteoporosis, even though I did all the lifestyle interventions. Sometimes it's just a genetic predisposition.
Hmm.
But
Yeah.
if I
So
would have waited till I was 65, I would have
you
lost
really would have been a
I would
lot
have
more.
lost 10 to 15 years of lifestyle intervention change.
Correct, correct. And
Yeah.
basically what you're doing now is only going to help you going forward,
Yes.
and it's not going to worsen it. So
Yeah.
these are things that, you can't just you have to think outside the box. You have to think bigger.
Yes.
And again, this is looking at the overall patient. And these are things that, um, more practitioners need to start looking at and doing. And unfortunately, I think being in a practice where you have to see 30 patients a day, you don't have that kind of time
Right.
frame to dig through everyone's history and see when was the last bone density, the last mammogram, and this is where things can fall through the cracks.
Yeah.
And another fun thing I love to do is a pelvic ultrasound on everyone. I do them
Mm,
every year when they come, especially if I'm going to be starting them on hormone therapy. I want to make sure the endometrial echo and the uterus, everything looks well before we start stimulating them with hormones.
mm,
Because as you know, some women, when you initiate hormone therapy, they have breakthrough bleeding, they have, postmenopausal bleeding, and we don't want
yeah.
to alert them to something being wrong because we know it could be a part of the norm within the first year of initiating HRT. So if I know my baseline and I know that cavity is clear and there's not a polyp and there's nothing, then I can safely guide my patients and then, kind of do what needs to be done if there is
Hmm.
an abnormality that we.
Yeah, that's really interesting. I haven't heard that before. I like that. What
Yeah.
about ApoE? Do you test for this genetic
It's
variant?
another it's another variant and it's part of my whole panel. It's just not
Talk,
as
talk,
popular as
yeah,
the yeah.
define what the ApoE test is and why midlife women should maybe get curious about it.
So we're looking, remember the cholesterol molecule, right? There's different components on it, and that's what it's looking for. Is ApoE is one of those little markers on that tells us whether there's chance of plaque formation, more cholesterol in your system, and what do we do about it? And so it's all of these newer markers that are being found that now we're testing for, and you put it all into correlation with your cardiac risk factors and decide, okay, where do I need to go with this one? What do I need to do about it? And who needs to be evaluated further with a cardiologist and further testing?
Yeah. So, but I think you're talking about the ApoB.
B, sorry, yes,
I'm
you
talking
said
about the ApoE.
E. Okay,
Yeah, the
yes,
alleles, the ApoB genetic marker for Alzheimer's disease.
yes. Oh,
Why should midlife women need to know about this gene?
well, remember, we have the brain, there's estrogen receptors everywhere there. And as estrogen receptors go down, so will your chance of developing Alzheimer's, dementia, things like that down the road. So we want to be proactive about it. And that is another marker that we found now that if you notice in the brain, then you have to be more proactive in terms of lifestyle modifications, alcohol, all of those kinds of things will play a role in what can happen down the road, especially if there's any kind of genetic predisposition for Alzheimer's development. You need to be more proactive and consider hormones if that's okay and you don't have any other background risks.
Yeah, so I'm an ApoE4 carrier myself, and I have 5 kids, and 3 of them are as well.
Hmm.
So, it doesn't mean you're going to get Alzheimer's, but it definitely increases your risk.
Risk.
So for me, lifestyle intervention is obviously the foundation of supporting that. But what's also really interesting about the ApoE4 allele is its connection to heart disease, increased risk of heart disease, and also being a hyper absorber, which I mentioned, which is why I take
Right.
Zetia. So I think just, a lot of people say, I don't want to know if I have the Alzheimer's gene. And that's fine. And I understand that side of the story. But for me, from my side of the story, I watched my dad die a
Hmm.
horrible death. Like everything was wrong with him. And he didn't live a healthy life. So the epigenetics just, failed him completely, So for me, my why was I want to know the full extent of my health story. And then I want to be given a buffet of options and what I can do, what I'm ready and willing to do in any given time in my life, and then sort of build on top of that. So, and there's a lot more women who are approaching their longevity like this. They want to capture their entire health story and then make choices in the direction that their genes are going to be supported, their mitochondrial function will be supported, their sexual pleasure. I mean, that's a big one. I
Right.
want to know is all the things I'm doing, if they're going to lead to me not feeling like I want to have sex with my partner, something's missing.
Right. No, and that's why we need to be open. We need to be curious and learn and find out. Again, you want to do testing, you want to do the epigenetics, you want to do all of that background. And that way we know, okay, there are things I can do to modify these risks. Okay. Now, something else might happen, but at least you've done your part. That way, when you get there, if something happens, you can't say I didn't know and I didn't do anything about it. You did everything you could, and hopefully it won't happen. But if it does, it may not be maybe as severe as what it could have been had you not done any interventions.
Yeah, exactly. A couple tests I wanted to ask you about before we end the episode: telomere testing and biological age testing. These are definitely like extras, right? Icing
Yeah.
on the cake. What are your thoughts
Mhm.
on them?
I like the biological age testing just because then you can kind of see. I think it triggers some people to put in those lifestyle modifications
Hmm.
because
Hmm.
let's say you feel great, you look good, and you're like, I'm doing okay. You do this test and it comes back that you're older than your chronological age. I think it kind of shakes them up. It's like a wake up
Hmm.
call,
Yeah.
call to action. Okay, you know what? I thought I was good. I guess I'm not that good. So let me modify these things and it becomes like a competition for themselves with themselves. I want to do
Hmm.
better. That way, when I go get retested, maybe my, cellular age has improved and now I'm healthier. So
Hmm.
I like using it in that context. Telomere, I haven't done much on that one yet, but again, it's one of those big topics that's coming out.
Hmm. Well, Dr. Gila, thank you so much for all of your wealth of information on longevity and midlife. It's a puzzle to put together. It's slow moving, and we definitely need to be partnered with providers and even health coaches to really help navigate this time in our lives. What are your thoughts on health coaches? I always ask my guests this.
I think they're a big help to us providers
Yeah.
because it's in conjunction. Again, a lot of us don't have that kind of time to sit and explain every little detail as it should be, because that's
Hmm.
the only way. You said it. Women, if they understand what's going on, they're going to do something about it. But if you
Hmm.
just give them a slew of supplements and a couple of prescriptions and say, take this and come back and see me in 6 months or a year, 90% will not follow through on that.
Right.
So I think you, in conjunction with healthcare providers, are providing a service where these women feel supported, heard, and then they understand. And if they have any questions, they can, between you and us,
Yeah.
we can get all those answered and kind of get them to do what they need to do to become the best versions for themselves.
Yeah, I always say that health coaches bridge the gap between leaving your provider's office and showing up at your front door,
Right.
right?
Absolutely. Yeah.
Yeah, yeah. Um, if someone is listening to this thinking, okay, I'm into longevity, I get it now, I understand the mitochondrial health, I'm curious about this nitric oxide thing going on. What are three ways that you can suggest for a woman to just start navigating these components?
The easy ones. Your
Hmm.
nutrition, change everything. Just go out there, look in your cabinets and take everything out and start all over again. Because more than likely, everything in there is processed. It's full of things that we don't need. So start with your diet, start with your sleep schedule. Sleep is so critical. It's so important. We need to get that full, restful sleep every night to
Hmm.
minimize stress on the body so that way it can work efficiently, like we spoke about. And then your
Hmm.
exercise regimen. I think those are the
Yeah.
three takeaways, is really just you got to hone in on those things. And that can be done today at home right away.
Wonderful. Great advice. I would add, get your healthcare team
Yeah,
together the way that you want it, right? With trusted collaborative partners.
correct.
Yeah.
100%.
What a wonderful conversation about longevity and midlife women. Thank you so much, Dr. Gila. Where can people find you?
I'm on social media, Dr. Gila Senemar, easy.
Mhm.
And then on my website at gilamd.com.
Awesome. I will put that all in the show notes. And everyone, thank you so much for tuning in to today's episode on longevity and midlife women.
Thank you for having me.
Thank you for joining me. I hope you enjoyed the podcast. Lifestyle changes can be hard and overwhelming to make. By building your support team of functional medicine doctors, therapists, and health coaches, you can reach your optimal health goals. Be sure to check out my other podcasts. Until we meet again, stay healthy.